morning. How you doing? My name is Tex. Welcome to Tex Talks. Somebody asked if I would speak a little bit on a diagnosis called EUPD, Emotionally Unstable Personality Disorder. So in order to do that for you, I have to give you a little bit of history. I'm not going to go into deep because it'd take a while, going through this whole trail. First, to understand its relationship to the diagnosis you see in the DSM, which is borderline personality disorder. Now, if you go to the DSM-5, there's the criteria for borderline personality disorder, and I talk about that in several other videos, and I also talk about the specifics of some of the things in borderline personality disorder. When you talk about EUPD, it's basically an understanding of where it comes from and why the term is used. That's an understanding of an ocean. The DSM is mainly used here in the States, and it's the one that, a lot of the insurance people will go by the coding they use, and it is the manual. And heck, I even got one up here. It's the big book. Okay. Now, jump over here, the ICD-10. They're constantly trying to tweak and rename things so that they have less stigma and more understanding, without going into a huge history of why certain things are called what they are. These diagnoses normally are characterized by a history, and in the case of borderline personality disorder, the original thinking is this is a disorder of the personality where a person is somewhere in between, on the borderline, between neurotic behaviors, which is the old term for OCD, anxiety, depression, things that used to, they first started doing things for mental health, and psychosis, which is a break from reality. And so these people were riding the borderline, if you will. And so that's how the name got started. The EUPD is a better descriptive term of understanding that, because basically a person who's diagnosed with BPD is emotionally unstable. And if you look at borderline personality disorder, one of the things is basically that those mood swings, unstable mood, along with problems with frustration tolerance and anger levels and things like that. There's also a break apart when you start looking at things from a European mode of thinking when it comes to object relations, which object relations is something that I'll probably go into a little bit deeper in one video. It's a way of understanding how early attachment shapes a person and how they see things in their mind, in their mind's eye, even before they have speech, and how you develop and understand your relation to self and others, your ego states, and the representations that go on inside your head. So then if you shift into that, there's several people, Kernberg, Yeoman, back a little bit further, and you have Mahler and Fairbairn and all these different experts as they come in that line of thinking that have slowly now put it to where if you read some of the later books on like transference focused psychotherapy, there's a diagram that has basically all of these things in here, and the borderline personality disorder behavior within it is several other diagnoses. So it's a way of understanding the exact specifics. It's the way they break it down, because if you look at the ICD-10, when they have EUPD, they also then will have you break it down according to the type of EUPD. And one of them it lists will be in the ICD-10 is the borderline listing. In the ICD-11, they have explosive personality disorder, kind of is applicable to that. And if you look over here at the DSM, you're getting more into this anger, and they're trying to come up with a diagnosis for the angry behavior. But you also have aggressive personality, and that is a disorder. It's applicable to that. So the ICD-11 is trying to encompass it this way, the ICD-10, the aggressive, and the borderline. So you can see how they're changing things around. And you go, well, why are they changing the names on this? Why are they going about doing that? Again, some of it's stigma. For a long time, since people didn't truly understand where BPD came from the behaviors, the symptoms. What was the causal factors? And they also didn't understand as well how to treat it. It got a bad rap. So that now, like many words, bringing that into the present and going into the future, there are people who feel that, well, it should be renamed so that you can release some of the stigma and make it more treatable. Because a lot of people don't want to be diagnosed. Here's where my 2 cents comes in. Take it for what you will. It's just my opinion. It's not the rule. Oftentimes I find that if there is a label that you don't like, if you own it and you take charge of it, then you're allowed to change it. Think of all the names through history that have become derogatory. See that the person that has been labeled that at some point, take it, call it, grab it there and say it's mine. And then they actually come to terms with, and I have this and I can deal with this and I am better for it. Then that's one way of handling when words become problematic. Another is to rename things. I tend to be more in the category of, if you have borderline personality disorder, if you have BPD, then you label it, you name it, and if you want to, you change it. If you don't, you don't. It's yours though. And in that sense, you work your way through it. Because if you remember at some point, it used to be stigmatizing to have bipolar disorder. In fact, it was stigmatizing to have any disorder. Today, it's still very scary for people to be diagnosed with schizophrenia because of the press that's out there. I think as more people come forward, though, and you realize there are a lot more people out there with this diagnosis who are getting help for it, and, especially people that are in the news and in the arts, people that you look to and go, oh, okay, they're saying they have this problem, they're working with it. Then it becomes less stigmatizing and more of, okay, it's just another thing that we have to deal with, like high blood pressure, diabetes, anything else. So from all that I can tell, there's no specific difference rather than the labeling of itself. And if you're overseas, you're probably going to be diagnosed then with emotionally unstable personality disorder with signifiers. If you're here in the States, you're more likely to get a DSM diagnosis, which is going to be borderline personality disorder. People will say, why have diagnosis at all? Here's the catch on that. Again, my opinion, don't connect it to nobody else. This is me thinking in my own head. In order for me to properly work with someone, I have to have an understanding of what's wrong. I can guess and throw things at the wall and hope they stick. If I'm better able to diagnose, though, then I'm better able to form a treatment plan that is specific for that problem. To me, it's very similar to the one with, everyone gets a cold, and instead of actually being able to distinguish whether or not this is bacterial or virus, they just throw antibiotics at it, hoping just throw the book at it. And one of them's going to work. And that's not always the case, because sometimes you need a certain antibiotic and you need it at a certain level in order to get the best effectiveness. And all the other stuff, you're taking this antibiotic that's not working and you're wasting time being sick when you don't have to be sick because you didn't get the proper diagnosis to begin with and get the proper medication for that diagnosis. Same way with most of your mental health stuff. If you get the proper diagnosis, then you can move on that and establish it instead of trying to worry about whether or not it's going to upset people when you give a diagnosis. Figure out a way to give people a diagnosis so they better understand themselves and they feel okay with it and they get the help they need from it. The EUPD, I think it's like any of the other diagnoses that you see. Sometimes if the different coding manuals, they label it different. For some people, it's a feeling that, oh, I would rather have EUPD than BPD because BPD scares me. I got that. If it makes you happy, let's roll with it. Let's get you the treatment you need. Let's get you the help that will get you where you want to be. Let's help you achieve your goals, and let's help you make your life the way you want it to be. That's what's important in the end to me. If you need to look at it from a different angle in order to do that, then I understand. It's cool. Life is good. Tomato, tomato. Hope that helps a little bit with EUPD, and I hope that answers your question. Y'all have a great day, and I will talk to you later. And thank you very much for tuning in.